First Aid. My name is Denise Ellsbury, and this month we're joined by Melissa Hedlund Nelson. Melissa and I have known each other for a number of years through some other work that we did together, but Melissa works with me at Linden Oaks, and she is part of the clinical expressive therapy team, which is part of the rehab services department at Linden Oaks. She is a board-certified registered art therapist, and she has a lot of other experience. So she's here to talk with us about the expressive therapy program at Linden Oaks and a little bit about art therapy. So welcome, Melissa. Thank you for being here.
Thank you, Denise. Thank you for having me.
So why don't you tell us kind of about all of your different experience and professional experiences?
Mm-hmm. Absolutely. Well, I'll start off by saying just my credentials, if that's all right. So board certified registered art therapist, like you said, and then licensed clinical professional counselor, a certified alcohol and drug counselor, and then a somatic experiencing practitioner. And so I do a lot with art making, the body, regulation as well.
Okay.
Yeah.
So when we talk about expressive therapies, then you've got that art therapy piece, but some of the body movement experience as well, and then expertise in terms of the clinical, like you say, the therapy part of it also. So you're combining a lot of different areas of knowledge.
Right. Whew. Right, which is great at Linden Oaks because so many of our patients, they come in and they're very dysregulated. And so integrating the art making with the body and just calming down and bringing regulation to a very dysregulated system is a lot of times what they need.
Okay.
Yeah.
So I mentioned that you're part of the rehab services team at Linden Oaks, and we also talk about like expressive therapies, kind of use those. So what is all that about?
Yeah, so we have anywhere from 16 to 18 expressive therapists at a time, which is a lot, which I feel is really groundbreaking for a behavioral health hospital to have that many expressive therapies, expressive therapists, expressive therapies. We have dance movement therapists, there's a certified occupational therapy assistant, music therapy, recreation therapy, and then art therapists.
Okay.
And so we're a team, and we go out in the hospital providing groups and individual support for the patients, both inpatient and then outpatient at Linden Oaks.
Okay. So at the inpatient hospital, there's like 108 beds or so, and so staying busy within those different units at the hospital.
Right.
And then you also go to some of the outpatient programming as well. Okay. Wow.
Yeah.
I didn't realize there were so many people as part of that
There's
team.
a lot of us, yeah.
Okay.
And we move around quite a bit as well, providing support wherever we can on the units.
Okay.
So,
well, how you said that was kind of groundbreaking.
Yeah.
And is that not just sort of a typical part of inpatient or outpatient treatment, or what makes that groundbreaking?
I would say no. Typically, having an expressive therapist in a behavioral health treatment center is more luxury. And the fact that we have so many, it's just, Linden Oaks really sees that patients need more support than just talk therapy, especially when they get to the point where they may be suicidal or homicidal. They need other treatment modalities to help them regulate, to help them heal, help them grow, rather than just like sitting and talking about problems. So having the art making, the movement, music, all of those things help bring healing. And so I feel all behavioral health systems should have them, but they don't. It's more of a luxury, I would say, in today's world to have that many expressive therapists.
So it's cool that the health system makes that, views that as a really important aspect of the treatment that's provided.
Right.
Yeah.
Right.
It's so interesting that you kind of, when we talk about treatment, I know people think about, mental health treatment and kind of like, oh, you're talking medication, or you're talking about sitting and talking to a therapist. But, just our conversation here, you're kind of broadening it, saying, wait a minute, we need to look at some other aspects of what's going to be helpful to people.
Right. Right. Yes, there's many different ways that you can help an individual heal and help them regulate. But really, there needs to be more than just talking about it. Oftentimes, talking about it is what led people into the struggles that they have. And with words, we can manipulate, we can lie to ourselves. But when you create an image, you can't really lie with that. Like, the truth comes out in it. Our unconscious can come out in an image. And so bringing that in with the talk, of course there's value with talk therapy, but bringing that in and bridging them together is so helpful and needed.
You know, and I was thinking too, it's like sometimes when people are in such either escalated, or you use the terminology deregulated state, they may not even be able to talk. At that point.
Right, absolutely. Additionally, like where the trauma happened, you know, did they have traumas before, like pre-verbal? You know, did they have traumas when they were in utero? Things that when they didn't have access to words, and so they could have been pre-verbal. So it's like they don't have the words to express that, and then it can keep playing out in their life, the trauma over and over. And it can eventually lead them to needing inpatient behavioral health treatment.
Sure.
Yeah.
Sure. So when a patient comes in to the hospital, how do they determine whether or not one of the expressive therapists is going to work with them, or does everybody have an opportunity to work with the expressive therapist?
That's a great question. Everybody does. The way that we're set up at Rehab Services, we go to all the different units and provide groups during the day, anywhere from 2 to 3 expressive therapy groups a day. With like diverse amounts, like it could be dance movement, could be rec therapy, could be art therapy. So all of the patients have access to it.
Okay.
Yeah.
And then some patients may have a little more individual time, and how does that get determined?
That's determined by the treatment team. And so all the expressive therapists, like depending on what unit we're predominantly on, will go to the treatment team meeting and, you know, voice our concerns or any therapeutic insight that we have. And that's where they determine, okay, this individual could benefit from some individual work with an art therapist or a dance movement therapist.
Okay.
Yeah.
And that might be based on your observations of that person participating in group, or one of the other part of the treatment team, nurse or something like that, saying, hey, this is our observation of this patient, that they might really connect with you well or benefit from those services.
Okay. And some of our patients, we're seeing a lot more children right now that have autism, and so they don't have the verbal ability to express themselves. And so they benefit greatly from bringing the art in, because they can't express themselves as you and I can, but they can through the art, and that also helps with regulating and calming them down, because when they can't express, they get really frustrated and angry. Of course, I mean, they're feeling not understood. So a lot of the kids that we're seeing that have autism can benefit.
Okay. All right. So a number of different kind of concepts that have come up in terms of our discussion so far. We do have to take a break here, but when we come back, I'd like to dig in a little bit more to just kind of understand maybe some of the concepts behind art therapy, and kind of maybe a little bit about the training that you have to go through in terms of being an art therapist.
Absolutely.
So join us when we get back from break to hear a little bit more about art therapy. Welcome back to Mental Health First Aid. We've been talking with Melissa Hedlund Nelson about her work at Linden Oaks Hospital as part of the rehab services team, and she's been helping us understand a little bit about art therapy. But I'd like to maybe get a little more background just about art therapy in general. Like, how has that always been a part of sort of mental health treatment, or help us understand the
Yeah.
concepts behind art therapy.
Yeah, absolutely. Well, I think for a very long time we've been making art, and even in behavioral health, they found for, I don't know, centuries that art making has been beneficial for the patients, especially those that were unable to express with words, those maybe in a deep psychosis or having really significant delusions, hallucinations. They may not have been able to speak with words, but could create images that help calm them down. So I think for centuries we have been including art making in behavioral health treatment, but only recently, the last century, we formalized it into a profession, art therapy, that has, master level training where art therapists, it's post-bachelor, it's a 2-year degree. That includes a 1,000-hour clinical internship where they're out in the field, they're getting practice working with patients or clients doing art therapy, and then they can become an art therapist after they complete their clinical training. So it's a pretty intense degree. You learn a lot about counseling theory, different psychological theories as well, and the art making, the actual physical properties that come with art making.
Okay.
Yeah.
So you'd have to have some passion about art making,
Right.
In order
Right.
to go into that, because that's going to be one of the key tools that you're using. Okay. So
Yeah.
how did you, have you always been an artist, or how did you decide to go down that road in terms of the clinical aspect?
Yeah, that's a really good question. Ever since I was a little girl, I remember making art, and and I believe children, they tend to draw images over and over and over, certain ones. It might be rainbows or flowers or, snowflakes, different things. But I always drew hearts over and over. And I remember specific images that I created, as a little girl. I still remember, which is, I don't know, it's strange, I feel. But I decided I was going to be a medical doctor, and so when I was getting my pre-medicine degree, it came time to apply for the MCATs and go away to medical college. Well, go into more training for it, and I wasn't connected to it. I started feeling really depressed and defeated because I really wanted to go into a profession that I felt was connected with my soul and connected to what it was I was intended to do in this world. And so I didn't know what I wanted to do. I just knew it wasn't medicine. And so at that time, I went to the local campus grocery store and I got a little 99-cent set of watercolors and just some copy paper, and I started painting. And I hadn't created since I was a little girl. That's something that I focused on the sciences and I got away from the art making, but I started creating again and I started to feel better. And I was like, what is happening? Why am I feeling better? And I knew there was something psychologically happening, but I didn't know what. And so I started researching psychology and art making, and then I discovered the field of art therapy. And I was like, holy cow, this is amazing. This is what I want to bring to others. And so I went and I got my master's, and now I'm doing it. So it's like my soul's calling. It's so connected to who I am and why I'm here. Yeah.
So you have your own kind of personal experience of how art making helped you, right?
Right.
in that spot where you were feeling depressed and that something wasn't right, that it was the act of making art that was sort of that initial piece to help move you forward.
Right.
Yeah.
Right. And it was so simple. I don't know. I just intuitively knew I needed to be creating. I didn't know why, but it was something so simple. And that's, I believe, the beauty of art making. Anybody can do it. You can do it with anything.
It's interesting though, because people get really judgy about their art, don't they? And
They
so
do.
how do you deal with that as part of the therapeutic process? Because I know, anytime, oh man, that didn't look really good or something. So how do you address that as part of the therapy process?
So we try to set it aside. Like, the judgment comes along with it, especially for those, well, it could be for those that are trained as artists and those that are not trained as artists. And I found that those that are trained as artists, they've developed an additional critical mindset. Like, we have critical mindsets just because we're a human being as part of the human experience. But the artists, the trained artists, they can also see, like, okay, there needs to be shading, there needs to be a baseline, because they've been taught those things in their training. And so for the artists, sometimes it can be even harder to fully engage with the art making and let whatever organically needs to appear without coming in with, okay, no, there needs to be this and this and this. So in treatment, I always just say, let's just set it aside. Like, we're not going to judge, we're not going to critique, we're not going to interpret, we're just going to create. Whatever it is that you put on the paper, beautiful. Could be scribbles, could be lines, could be stick figures. We're just going to create and see what happens.
Okay.
And usually that works. I mean, people will still say, no, I don't know, I can't do this, I can't even draw a stick figure, but I just, with some gentle encouragement and the art materials laid out on the table, like, their hands always wander to like the pencils or the markers, and they begin.
Okay.
Yeah.
Do you, are there specific sort of, assignment isn't the word, but like art, types of art or specific activities that you use with different kinds of patients, or is it more sort of like people do what they need to do?
Yeah, I'll say absolutely. And we call them directives.
There you go. I knew there was another term for it.
So, like, for instance, on our Gero unit at the hospital, we want to do things that are more sensory.
Okay.
A lot of the patients may have pretty significant dementia, be very confused, not understand why they're there. And so doing things that are sensory, tactilely stimulating, can help with regulating and calm them down. So like a collage, like something simple, but also powerful in its regulating abilities. So like just putting some glue on tissue and crumpling it, right, and putting it on the paper, things like that. Also, we've done with them where we'll have half of an image and have them create the other half to see, like what's happening, like what they're able to do, like cognitively. Also, because you'll see very interesting things if it's like half of a flower, and then do they recreate the other half, or are they drawing a smiley face, or like what's happening there? So on the Gero unit, we do definitely more sensory, sometimes cognitive based directives, but then on the adolescent unit, we may do something that I do a lot more grounding work with them. So creating images of a safe place, creating a calming place. But I do give them a lot of options with art materials, because our kids, they've lost a lot of control, a lot of power. And so providing different art materials for them to decide, today I want to work with markers, or today I want to work with watercolors, so that then they can decide what art materials they'd like to work with, which brings back some of that self-empowerment, which is really cool.
So, there's a lot of nuance that's in the work that you're doing, in terms of it adds to things diagnostically and is part of that therapeutic piece as well. So fascinating, so fascinating. So when we come back from our break, I'd like to hear about some of the other work that you've done in the community as well, Melissa.
Okay,
so
sounds good.
Join us after the break to hear more about Melissa's work in the community with art.
Their support changed my life.
They were like family.
My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. I'm Denise Ellsbury, and we've been visiting with Melissa Hedlund Nelson, who is one of the art therapists at Linden Oaks, part of the Expressive therapy team. And it's been really fascinating to learn about art therapy and sort of the choices that you make in terms of working with patients and how that's helpful in that hospital setting. But I know that you've been really active in the community as well, so I'd really like to hear about some of those things that you've done in the community.
Yeah, absolutely. So about 7 years ago, I don't know. I had an inkling to start a not-for-profit. I guess it was more than an inkling. I felt it was a calling to create a not-for-profit, and so I set out with my sister to develop the Light of the Heart. It's a community art therapy project in Aurora, Illinois. That's our home base. But we provide art therapy and counseling for, right now it's predominantly adolescents, but we've also done all ages, all backgrounds in the past, working with adults, working with really little kids, just bringing light to those in need through the arts.
And so you have a physical space for that practice, correct?
We did.
Okay.
We're shifting.
All right.
We're shifting a little.
Okay.
So we had a studio in downtown Aurora for, I would say, 4 years, different studios. We started out with a smaller space and then went larger. And then actually this past year, we decided to close our physical studio and focus more on the schools and not have individual sessions at the studio. And so now our art therapists are really focusing on getting into the schools in Aurora, providing art therapy during the school day for a lot of at-risk children, children that wouldn't have access to mental health care otherwise.
Oh, that's very cool.
Yeah.
And so you kind of take your stuff with you and go out to and kids that are referred to you for specific kind of mental health concerns or counseling needs.
Right. And a lot of these kids, they've experienced significant traumas, gun violence. There's a lot of gang violence in Aurora. And it's oftentimes like in the junior high, we're seeing it quite a bit with the gang violence. But they, like I said, they wouldn't have access to these services otherwise. And so our therapists, they bring art supplies and they go into the school, and the kids, it could be during a study hall or a gym, something like that, where they come and they meet with the art therapist and they can work through things that they wouldn't be able to otherwise, which is really cool. Yeah.
And how do you find the kids, how receptive are the kids to that experience?
Yeah, they're actually really open, a lot more than adults. There's something about children, like they just, well, even adolescents, like they just gravitate towards the expressive arts and have a deep desire to create. And so they begin. And asking a child, tell me about your struggles, tell me about, any traumatic events you've been through, can be really challenging verbally, but they can create images that then contain that and allow for them to get so much out of their body that they may otherwise feel not in control. So it brings control and a powerful way for them to express.
Cool.
Yeah.
So you have other art therapists that are working with you in that?
Yeah.
Okay.
Yeah.
Nice. And how about other stuff? Because you've done some other things, I know, like bigger events out in the community also, correct?
Yeah. So every year we have Art Jam, which is an art and music festival where we raise funds for programming, and we feature youth bands and youth performers, like a youth dance team, Simply Destiny. They typically perform every year. It's just a powerful way to honor our children and their talents. So it's really amazing. There's a series, 3 to 4 bands that perform. We have art making activities that happen at the same time. And it's just so cool to see people coming out from the community, embracing the light of the heart, embracing the children and all their talents, and creating art.
Nice.
So
nice. Yeah, and I think it's nice for those young people who may not be involved in the more structured activities at their school to have opportunities to contribute in the community or demonstrate, what their interests are and their skills are through that venue, as opposed to like those official school sanctioned kinds of things.
Right, absolutely.
When does that art jam typically happen?
Every year in September.
Okay.
And so we just had our jam a couple weeks ago, and it rained that night, but we still...
Was that the totally rainy weekend?
It was one of them, but we did it anyways, because our bands, they were so excited, and one band in particular, they sang a lot of rock and roll type music, and they were just so excited, and it was so cool, because there was people from the newspaper there taking photos, and they just totally lit up. And that's what we want. We want that, so it's cool.
All right. So you are a busy person between your hospital inpatient work at Linden Oaks, and then the things that you're doing in the community as well. Yeah.
Yes.
So how do you find time for sort of do you do art for your self-care?
I do. I would like to make more, but I do. I have to set aside time, and it's nice because in our new home I have an art studio with art supplies, and it's very inviting. So I have to kind of force myself to set a time, maybe on a Sunday or a Saturday, where I go in there and I just create. Because if I'm not doing it, how can I hold the space for others to create? It's I have to be connected with the source as well.
So you still utilize that as one of your self-care kinds of things?
Yeah. Yeah.
How would you suggest other people maybe start to explore that as a self-care strategy?
I think just getting something simple, something that they feel comfortable with in terms of art supplies. Like I did, I just got a little set of watercolors. Maybe for them it could be even starting with a coloring book. The coloring books are really popular right now. Just something very simple, and seeing where that goes.
Okay.
It could, starting with a coloring book could then lead to having canvases and paint.
Okay. And if someone was looking for maybe some outpatient therapy or something like that, and felt like art therapy was something that might be a little more helpful, what should they be looking for in terms of a clinician?
I would say definitely somebody that's trained as an art therapist, but also the counselor. And in the state of Illinois, it's nice because all of our master's training programs in art therapy, they train art therapists to be licensed clinical professional counselors in addition to the art therapist. So I think those two pieces are important. And actually, we just started offering outpatient therapy at the individual level at Linden Oaks.
Oh, okay.
So we have an art therapist now that's providing art therapy, which is really amazing.
As sort of like weekly counseling, kind of. So as people looking different levels of treatment that they might need, they're able to access the art therapy piece on that outpatient level, in addition to those different levels of hospitalization. Oh, that's very cool. I didn't know that. So that's nice to know. Yeah, because I think people may think drawing. No, but you really want people that have that professional degree in both areas.
Right.
So,
Melissa,
thank you so much for being with me today. We learned a lot about art therapy and everything, and all the different things that you do. So thank you for joining us in Mental Health First Aid as we've talked with Melissa Hedlund Nelson. And until next time, be well.